If you have been told you have a varicocele, you are probably worried about three things right now: your testosterone, your sexual performance, and your fertility. And for many men, this becomes a long-term source of stress. But here's the problem. Most explanations stop at the veins. And that still doesn't explain what's really going on. You've likely been told it's just a mechanical failure, a few leaky valves in the scrotum that need to be tied off or ignored. But as someone who has spent over 20 years in integrative medicine, I can tell you this. Focusing only on the veins is like looking at a single leaf and missing the entire forest. That explanation is correct, but it's fundamentally incomplete. It tells you what is happening, but it doesn't explain why your circulation became dysfunctional in the first place. Today, we are going to look deeper. We are going to reframe this, not as a local vein problem, but as a systemic circulation issue that traditional Chinese medicine has understood for centuries. Before we get into the why, take a moment and think about this. What concerns you most about your health right now? I am curious how you see it. Let me know in the comments. I read everyone. In conventional medicine, varicocele is usually described as a problem of the veins. The valves don't function properly. Blood begins to pool, and over time, this can increase local temperature and affect testicular function. That's true, but here's the key point. It still doesn't explain why the system failed in the first place. In clinical practice, we often see that the severity of the varicocele does not always match the severity of the symptoms. Some men have large varicoceles with perfect testosterone, while others have minor ones with significant ED. This is because the issue is bigger than a local vein problem. It is fundamentally a circulation problem. Your body's circulation is governed by the whole system, not just one region. And the lower body, especially the pelvic floor and the scrotum, often reflects what's happening upstream. If the overall circulation is not functioning well, local problems will inevitably appear. You have to think beyond the vein itself. So we have to step back and look at the whole system. Traditional Chinese medicine does not have a single modern term for varicocele, but our ancestors described it vividly in ancient texts. In the Ming Dynasty, the physician Chen Shigong wrote in his work 外科正宗 about a condition called 筋瘤 or muscle tendon tumor. He described it as firm and purple in color, with the vein like coiled earthworms. Another term used is 筋疝 or tendon hernia, which the Jin Dynasty text 如门氏亲 described as a swelling and tension in the scrotal area. These ancient doctors were not just describing the appearance. They were identifying a profound dysfunction in how qi and blood move through the entire system. In the traditional Chinese medicine framework, we look at this through the lens of qi stagnation and blood stasis. But I want to be clear, this is not just about blood sitting still. It is a dysfunction of how the vital energy, or qi, and the blood move in harmony. If the qi, the force that governs movement, becomes stagnant, the blood follows suit. This is not just blood stasis. It is a systemic failure of flow. When I evaluate a patient, I am not just looking at the scrotal veins. I am evaluating the whole body. This is where most people miss the real issue. Many patients with this condition also show signs of systemic stagnation, such as digestive sluggishness, tension in the pelvic floor, or even a history of poor cardiovascular return. The key question is not just what is happening in the scrotum, but why the body has lost its ability to maintain upward flow against gravity. This is where the whole body perspective really becomes important. The pelvic region is the lowest point of the torso's circulatory loop. If there is upstream congestion or poor regulation elsewhere in the system, the downstream veins in the scrotum may bear the brunt of that pressure. Local problems often reflect global dysfunction. If we only treat the surface by tying off a vein, we have not addressed the systemic reason why the pressure was high to begin with. This is why some men experience a recurrence after surgery. If circulation is not restored at a systemic level, you are only treating the surface. Our treatment approach, therefore, focuses on restoring that systemic flow. We use acupuncture not just to target local points, but to help regulate the overall movement of qi and blood throughout the body, especially the pelvic region. Herbal medicine is also used to support circulation and resolve stagnation, but not in a fixed or formulaic way. What we are really doing is observing how the system is functioning in each individual, how circulation is behaving, and how that process continues to evolve over time. Because this is not a static condition, it is something that keeps changing over time. In some people, you may see more tension and constraint in the system. In others, you may see a kind of downward pressure or lack of upward movement. But these are not fixed categories. They are different expressions of the same underlying issue, the loss of coordinated flow in the body. And the treatment has to follow that process, rather than forcing it into a predefined framework. When circulation begins to improve, not just locally, but across the system, we start to see changes in the internal environment. Blood flow becomes more efficient. Oxidative stress may begin to decrease, and the internal conditions that support normal testicular function can start to return. Modern research is beginning to move in this direction as well. We are also seeing more attention to the fact that microcirculation, oxidative stress, and inflammation are not isolated factors. They are part of a broader network of regulation in the body. While we don't make exaggerated claims, this perspective suggests that when circulation is restored at a deeper level, the body's ability to regulate hormones and maintain function can also improve. A varicocele is not just a problem of a vein, it's a signal. A signal that your body's circulation is no longer functioning as a coordinated whole. And in medicine, the real question is never just where the problem is, but where the system allowed it to happen in the first place.